Our top story on KPIX 5 and streaming on CBSN Bay Area, containing the spread of COVID-19 cases at Bay Area nursing homes. Good evening, I'm Ken Bastida.
And I'm Elizabeth Cook. Two hotspots in the Bay Area are at Laguna Honda Hospital in San Francisco and Gateway Care and Rehab Center in Hayward. Late this evening, officials at Gateway just reported their 13th death related to COVID-19, with 41 residents testing positive. The Alameda County District Attorney's Office has confirmed it has opened an investigation into the Hayward facility.
At the same time, there's a plan to allow nursing homes to set up special COVID-19 wings. Not everyone thinks that's a good idea. KPIX 5's Maria Medina investigates.
And do not touch my camera.
Okay. This was the reception our KPIX cameraman got when he showed up at the St. Francis Convalescent Pavilion in Daly City. The nursing home is building a special wing for COVID-19 patients that are discharged from hospitals but still need intensive care. And they're not the only ones.
I think it's a bad idea. It's a dumb idea.
Teresa Palmer is a retired doctor. Her mother lives at the San Francisco campus for Jewish Living that is also building a COVID-19 wing.
She's 102 going on 103. She served in the Navy in World War II, and her personal philosophy is she's planning not to die.
She says her mother, Bernice, has been happy and healthy at the home for years.
She's still walking all over the campus with a walker. She has her favorite places to sit in the sun.
But now Teresa sees a threat. The 30-bed COVID-19 ward that just opened, she believes, is much too close for comfort.
Are they going to hire separate nurses, CNAs, activity therapists, physical therapists, rehab specialists? This is unrealistic.
The Department of Health earlier this month told skilled nursing facilities that they have to take COVID-19 patients discharged from hospitals. But then the agency backed off and said that they can. A spokesperson told us that many skilled nursing facilities have, quote, stepped forward to do so.
I think it's more likely that facilities that take COVID-19 patients are stepping into it as opposed to stepping forward.
Tony Chicotel is with California Advocates for Nursing Home Reform.
Everything we're seeing in the nursing home world suggests that this spreads like a conflagration through the facility.
A recent Medicare survey of infection control measures conducted in nursing homes after outbreaks found 36% of facilities did not follow proper hand washing guidelines, and 25% failed to demonstrate proper use of PPE. Chicotel worries there's a profit motive for some of the new COVID wings that is not in the best interest of current residents.
It's not a hidden fact that patients coming from hospitals who qualify for Medicare are significantly more lucrative than the residents that they probably currently have in the building.
Back up 6 feet.
We wanted to ask St. Francis Pavilion about that, but they didn't want to talk to us. Later, the nursing home's director sent us a statement saying in part, quote, St. Francis Convalescent Pavilion is following state and federal guidance to be prepared to care for COVID-19 positive patients. The unit is self-contained, and the staff working the unit will not enter the rest of the building. The San Francisco campus for Jewish Living says it has set up a separate area on campus as well, with dedicated staff that has received additional training. So far, 2 COVID positive cases have been accepted from a local hospital. A spokesperson told us we are in active communication with the San Francisco Department of Public Health and other state and government agencies, and we are working very closely with these agencies to follow best practices in infection prevention and control. Teresa Palmer is not reassured.
The lives of nursing home patients are worth something, and they need to act like it.
As for her mother, Bernice,
I'm angry. I'm helpless. I don't want my mom to die.
And the State Department of Public Health is not publicly revealing which nursing homes are opening COVID wings. The agency is also not publicly posting what facilities have reported infected patients. And families of nursing home residents can't even get in to see them. So this is a really stressful time for anyone with a relative or friend in a nursing home. Liz?
Maria, it's so tough. Thank you for that report. Well, Governor